But when I mention the TV program Breaking Bad, what comes to mind?
Breaking Bad?
Yeah.
That's interesting.
Better Call Saul.
You know, I was just about to say that.
I beat you to it. I was thinking he's going to get it.
He did have his own show as well. Now, I would say that our next guest is a little bit more upstanding member of the community than the Saul that's in Breaking Bad. Welcome back to the Sports Dentistry podcast. So the Lions got the job done, Umar. 2-0, series won.
Series done and dusted, but I'll tell you what, Australia came out the blocks hard. I thought they were fantastic, certainly in the first half. You know, it was a completely different team, completely different beast compared to the first game. And in the second half, I think when the centre for Australia went off and the number 7 went off, I think it just went tits up, really, didn't it? And then we kind of got back in the game, and Jack Morgan, the only Welsh guy in the whole squad left, managed to get that tackle in at the end, and it was just euphoria. But deep down, I kind of wanted it to go to 1-1 into Sydney, because I just thought it would have been epic. Like, at 1-1 into Sydney, it would have been amazing. However, it is what it is, and I think they'll still want to win 3-0, and the Aussies will want to try and win. But you can see it in the Aussies' faces just how much it meant to them and how hurt they were. So I thought it was a great game of rugby.
Yeah, it was great. The Aussies played fantastic. It's a pity that wasn't the first test. The first test was so disappointing in comparison. Where if that was the first test, we would have been really excited for this weekend heading into the second test. But the difference is the power, like the Shelton and Valentini, the two Aussies, and they were massive. So
they dominated.
They dominated physically, and then once they went off, because they were just coming back from injury, they didn't last much longer than the first half. So it changed a wee bit to the Lions, but the Lions always looked dangerous once they got into 22, and it took 3 Irishmen to get tries. You know, we had to pull the rest of us out and get over the line.
It was Finn Russell pulling the strings, though. He was the orchestrator, and he was pulling all the shots.
He got some kicks in. It was unbelievable. It was like the TV wasn't even ready for some of his restarts. And he had them pinned right back in their own half before the TV was even ready to show the kick.
Oh, I thought it was incredible. And 90,000 people. Like, imagine being an athlete playing in front of 90,000 people in that magnitude of game that's been shown like all over the world, and you've had thousands of traveling fans to come and support you. It's hard to imagine. You know, I've played in some decent crowds, nowhere near anything like that. But even when there's been a few hundred in the ground, you're like, oh, wow, that's amazing. It's great. It's brilliant. And then to get to that level, wow, it must just be, I mean, the stories that those players can tell kind of going forward. And also, you know, the Lionesses won the Euros, but there was also something really, really big that was released at the weekend. I don't know if you've had a chance to watch it yet, but Happy Gilmore too.
Oh, of course. It was done and dusted Saturday morning.
Oh,
it wasn't.
Did you watch this as soon as it came out?
Yeah. I watched it as soon as it came out.
It was absolutely brilliant. I thought it was hilarious. The fact that they managed to get so many of the big golfers in, it was amazing, to be honest. I don't know how they managed that, but they must have obviously paid them. But wow.
just like the Irish lads had to score the tries for the Lions, it was Shooter McGavin came back to save the day.
Yeah, he did.
Shooter came back.
Yeah, honest. I just saw all the references to the first movie, and I thought it was. I mean, I've been reading some reviews, and people are like, "Oh, they should never have done a second one. The first one was so good." But actually, you take it for what it is. Like, the sequel was always going to be a bit daft, a bit silly, but I just thought the whole logistics around it was hilarious, and it's obviously. And it looks like all the golfers who were involved with it loved it. Is it loved being part of it? You've seen all their posts and the social medias. They've all kind of been like, "Oh, it was great. Adam Sandler was fantastic. It was really good." And I just think it was quite nice to see like a sport comedy film on, and what better one than Happy Gilmore too?
Yeah, it was brilliant. And they were good sports, because which one was it that was put in jail? That I think that's a reference to him actually getting arrested
Yeah,
to go
yeah,
play
Scottish
around.
Stifler.
Yeah,
Yeah,
yeah.
yeah.
That's a he was a good sport for being
Yeah,
able to do
that's right. Because he said me again. Oh, he's like, I know the drill when
that. Yeah,
he was
yeah.
getting handcuffed. Yeah, yeah. Yeah. No, I thought it was fantastic. Yeah, so it was I mean, there's a lot of great sport on again at the weekend, and it's hard to just stay on top. There's so much happening at the minute, but I think Luke Littler won the World Match Play Darts as well. So he's won the biggest three darts events available, and he's 18. It's like I
That's
don't care what
unbelievable.
sport. I don't care what sport it is, but if you're 18 and you've dominated the sport that you're in, and you've won three of the biggest prizes to win, that is ridiculous.
Yeah, yeah. He's going to be he's going to be historic. Like if he stays at it, if he doesn't go off
Yeah,
the rails. Now there is always that there is, there is always that risk whenever
that's it.
some of these athletes get to the top that
Yeah, I think it's. I
the
think
fame gets
yeah.
them. But I think he's pretty grounded. But it looks like he's going to be one of the all time greats.
Oh, definitely. And I love seeing players and athletes like that who are just showing what they can do and block out the outside noise, and they're just managing to perform. And it must be so hard being in the limelight at that young age and still. I mean, he's not even mature yet. I mean, 18, yes, but they say that men or boys don't mature until they're a bit older. Some would say that me and you are still not mature, but
Yeah,
it's
we've
one of
still
these
got
things.
time.
I've
There's
still
still
got time,
time.
yeah.
Still time. We've
Still
still got time.
maturing. I'm still
You're still
maturing. Yeah,
mature.
still maturing. Yeah, like a fine
We,
wine, just maturing
like a
over
right
time.
way. We had the All Ireland football final this weekend as well, so that's the end of the inter county, and we have a generational talent at the moment. It was Kerry against Donegal, and Donegal being an Ulster team, I was sort of looking for them, but Kerry blew them away. And Kerry are always a very strong team, but we have a generational talent at the moment in Gaelic football called David Clifford that plays for Kerry, and he's a joy to watch. He can play off both feet. He's so balanced. He's 6'3". He plays like a speedy forward. So just watching these players, and even the way Finn Russell is playing at the moment as well.
Yeah,
It's just seeing these athletes at the top of their game at the
yeah.
highest level. It's just a joy to watch.
But you're talking about the top 1%ers here in not just their sport, but worldwide. Like if you name these players, you'd recognize, you'd hear them. Oh, I've heard of that player, or it's like a Tiger Woods or a Michael Jordan or
Yeah,
Lionel Messi, and they transcend the sport. They transcend not just the sport that they're in, but out with. It was funny, obviously, when Finn Russell talked about being the equivalent to Lionel Rugby, the
the
Messi of
Messi of
rugby,
rugby.
Messi of rugby. Yeah, yeah, yeah. So I mean, it's good
Well,
to see, and I think
so far he's backed it up, so that's all right. He got plenty of stick for it.
yeah. Yeah, no, definitely,
So
he did for sure. So, actually, talking about the All Irish rugby, sorry, the All Irish final. Sorry, is that normally this time of year? Then is it like July?
it used to always be the third Sunday in September. And then recently what they've done, so it's all, you still play for your club, and then all the best players for the club get picked for the county. And what was happening was when you're on the county teams weren't letting these players go back to play for the clubs, and there's a lot of sort of uncomfortableness around that. So they try to look at it. So recently they've now changed it where the focus till now, July, is on county. So the clubs still play in the background. So they'll still
Yeah,
play leagues and stuff. The focus will be in the county, and then that finishes the season for the inter-county players. And then the club championships kick off, and all these players can go back to their clubs, and it can be a full competitive. So it used to always be, traditionally, it was always, the hurling final was always the first Sunday in September, and the All Ireland final was the third Sunday in September. But now they've completely rewrit the script to look at it from a player perspective. So all these players are still all amateurs, so they're all going to work and stuff like that. So it's not a professional sport, and probably never will be, because that's the ethos has always been an amateur sport. So they've changed it where it's to try to they'll call it like a split season, where it'll be county to now, and then these players, all these county players, will then go back to their clubs, and then it'll be a club
yeah,
focused season through
yeah,
to October, through to about October time.
yeah. Yeah, no, okay, that makes sense. Because I was thinking actually, when we take the sports UK sports conference somewhere else, we obviously still have to venture to Wales and we have to venture to Ireland. And I've never been to a hurling or a Gaelic football match, so that's something that we need to kind of consider going forward. I think that would be quite fun. Going to Croke Park and having a good time there would be quite nice. That leads us on in no way at all to what we're going to talk about now, our next guest. But when I mention the TV program Breaking Bad, what comes to mind?
Breaking Bad.
Yeah,
That's interesting.
Better Call Saul.
Depends. I was just about to say that.
I beat you to it. I
he
was
did.
thinking he's gonna get it.
He did have his own show as well.
Yeah, I know he did. Yeah, I know he did. But it all
Yeah,
came from Breaking Bad,
yeah,
didn't it?
yeah. No, I came from Breaking Bad. Yeah, yeah. No, I would say that our next guest is a little bit more upstanding
Yeah.
member of the community than the Saul that's in Breaking Bad. But we have the pleasure of having Saul. Yeah, I can't pronounce his second name. Kosiver,
Saul Konviser. Come on, man. You're
Conviser.
slacking.
I'm slacking.
You're slacking.
Conviser. And it's great because it's I think it's very nicely timing because a lot of sports dentists now, and we're seeing it. Most sports dentists are full time clinicians, and we've talked about how much of a gap there is in sports dentistry research, and all these full time clinicians, sports dentists are very keen to do research, but they maybe don't know how to go about it. So it's really interesting to have Saul on now that has undertaken a mountain of work to do this fantastic research looking into the oral health of academy players at the professional soccer clubs in England and looking at their oral health and seeing if there's any influence of that oral health on performance. And the research has recently got published and it's got a lot of attention. It's been on BBC. They've been very interested. It's on a lot of attention, both nationally and internationally. So really looking forward to having a chat with Saul to see, first of all, how he was able to undertake it, doing it as a full-time clinician with no background in research, and also what he found out.
Yeah, I think that's what we wanted to ask him, was just get a greater understanding of how it came about and the logistics of it working full time. And it was the inception of it was around COVID when he'd first approached Professor Pete Fine, about doing something like this. And with the title of the research being "Disadvantages Starts Early," academy football has high levels of oral disease, is what they titled the paper, and they were looking at the oral health of 16 to 18-year-olds who are part of professional football academies. So they end up going to 10 academies in and around London, and it'll be quite interesting to find out how they managed to kind of facilitate that, what they had to do, who they had to ask, what level of clearance they needed to get from the clubs and from ethics. So it was really interesting, and like you said, it's been published, and there's been a lot of chat about it because obviously there was the big paper by Professor Needleman a few years ago with regards to the state of professional footballers and their oral health as well. So to look at the younger generation and to see what it was like and compare that and see what it's going to, how that, so how it compares between kind of full on professional adult athletes and now looking at the younger generation, what the similarities are. I suppose it puts more into perspective. We need to get involved a little bit earlier, but that was the whole point of doing the research is that, do we need to get involved earlier? And if so, then what do we need to do?
Yeah, so it's going to go good. So looking forward to it. So let's go. Hey everyone, save the date. The UK Sports Dentistry Association's second conference is happening on Friday the 12th of September at the Voco Hotel in Manchester. And guess what? It's not just about teeth. We're combining cutting-edge sports dentistry talks with the thrill of live sport. Right after the conference, we're heading to Emirates Old Trafford for the England vs South Africa T20 International. Expect a day packed with expert speakers, athlete Q&A sessions, and plenty of time for networking with dentists, sports pros, and athletes alike. Whether you're in dentistry or passionate about sport, this is a day you won't want to miss. Tickets are live now at sportsdentistryuk.com. Grab yours and join us for an unforgettable day. It gives me great pleasure to welcome onto the Sports Dentistry podcast this week, Dr. Saul Konviser. Did I get it right, Saul?
Perfect. Thanks, John.
Perfect. It's great to have you on, Saul, and it's quite fitting because you've just did some really great research, which we'll probably get into in a little bit later in the podcast, into the oral health of soccer players. And the English Lionesses just won the European Championships this evening on penalties.
That's right.
Yeah.
So first team to back it up, do back-to-back, I think, European Championships. So that's a big result for them and a historic moment.
Yeah. I just actually read that in the knockout stages, they've only been ahead for 1 minute in the knockout stages.
Really?
Obviously, because they've been scoring obviously last minute, or they've been equalising and then go to penalties. So that's quite incredible, actually. Back to back, that's no mean feat, regardless of what sport that is. That's seriously impressive. But to be ahead for only 1 minute, that's that takes bottle.
Yeah, that's pretty
maintain
good.
at that level also, like, consistency. It's very impressive.
Yeah, absolutely.
So for anybody on our podcast that doesn't know you and haven't met you, just give us a wee bit of a background to how you got into dentistry and how you got into sports dentistry.
Sure. So I actually didn't take the traditional route into dentistry. I did a more generic physiology, pharmacology bachelor's in Bristol at UWE, and then spent some time living in Canada, working for some quality control. And then I did a master's in international health policy. So for me, getting a sort of broader picture of health policies, healthcare systems, how, application of, with regards to, say, pharmaceuticals and how that, infiltrated in the NHS, and then spent some time living overseas in South Africa, working in with HIV/AIDS education and policies and an NGO there. And then I came back and did some healthcare comms, and then I went into dentistry. And my dad is an orthodontist, so I think it was always there. But I think, as most teenagers, we don't want to do what our parents tell us to do. So I thought I'd take a slightly longer deviated route to get there. And then, but I've always had an interest in sports. I play sports. I do a lot of running, endurance events, running events, tennis, squash, football. Now recently more paddle as well. Slightly less traumatic to my body, I think. And then, just kind of came across actually the Eastman Sports Dentistry. It was a short course which they were doing at the time. Did it over a week, and met up with different colleagues there, and just got to see, as a clinician, for sport, I love sport, and it was a great my initial idea was, well, this is a wonderful way to apply my clinical knowledge and my healthcare knowledge from the master's point of view into, something that I really enjoy in terms of sport, almost like a hobby. And the more I got into it, the more I realized, well, actually, hold on a second, there's actually a lot of issues here at hand, way beyond just, say, dental trauma, for example. There are, and again, I try to look at it with a few different hats on, one as a clinical dentist, and the other with my healthcare policy hat on. And actually, there's socioeconomic issues there. There's political issues there. There's education side of things. There's healthcare issues, access to health. There's lots of different things. And then the more I got into it, the more you realize, from a dental perspective, is it something which is being kind of, I don't know, as a dentist, we're so precious about, our teeth and our and oral health, and we I guess we think everybody else should know about oral health as well. And I think I started to realize that actually there's a lot of sports teams, and they maybe weren't quite aware of the significance of oral health on their athletes. And it just kind of took me more and more down that route, and speaking with different colleagues and attending different events at European Association of Sports Dentistry and things like that, and meeting with you guys. And I suppose as I delve more into it. I thought, okay, well, I'd like to find out more and do some research. And that's when I kind of led me into looking at doing some research, looking at football players, because there's already been a previous study by Professor Needleman and co at Eastman. I think it was 2016, looking at first team footballers in the UK, which showed that there was high levels of oral disease, dental decay, caries, periodontal disease, gingivitis, trauma as well. So my view on that was, well, okay, what about the next generation? And there were recommendations as part of that study as well, and as part of the consensus statement, which was also published not long thereafter, saying that there should be a focus looking at younger athletes. And I suppose that then took me down the route of say, well, okay, well, I don't want to necessarily look at 12, 13-year-olds. I want to look at people that are already in a professional elite setup. So there is some, comparable data there, which is why we then decided, and with my colleague, Professor Peter Fine at the Eastman as well, looking at 16 to 18-year-olds in English football teams. And this was made up of a couple of components in terms of a clinical screening, looking at caries, soft tissue, so caries, gingivitis, periodontitis, tooth wear, and presence of trauma as well, and the puffer index as well. And yeah, it was very, and there was also a questionnaire, and part of the questionnaire looked at athlete or player behaviors, so their oral health behaviors such as attendance at the dentist, oral hygiene, routines, brushing, flossing, use of mouthwash, diet as well. But diet was mainly looking at their consumption of energy, sports, and fizzy drinks. With hindsight, it would have been great to have more time to be able to go much more sort of in-depth questionnaire. But I think the limitations, as any of your listeners would know when doing screening, especially in elite setups, time is very, very limited. And then the other thing, part of that questionnaire was looking at their attitudes and overall perception of the impact of oral health on their sporting performance. And then, we managed to look at 10 clubs around England. Most of them were London based or in and around London. And it was fascinating. I think, to see the levels, such high levels of oral disease across all of the parameters, actually, in people who have, and this was men's and women's, we saw 160 players who have access to some of the world's best medical facilities in these the sports grounds and training grounds, etc. To have such high levels of oral disease, I think was surprising. In my perspective, I think it was also concerning. Because I think there's also the socioeconomic side of things and there's the education side of things. So not just looking purely sort of dental, looking at sort of the wider, bigger impact of the other issues at hand here. And I think this is an opportunity to, highlight, and it was an opportunity to highlight to the other medical staff, the sports scientists, that actually, these are your players who are really in peak physical condition, and every aspect of their body really is sort of finely tuned. Yet their oral health is, really the data show that it was worse than that of the national average. And, high levels of tooth decay, higher than national average, high levels of gingivitis, periodontitis, for a very young age cohort. Okay, so we're looking at 16 to 18-year-olds. I think the most surprising figure was the significance of tooth wear. And at such a young age. And it did certainly, we know the different patterns of tooth wear and causes. And it came down really largely to the consumption of, acidity in the diet, parafunction. I mean, you could see canine tips were just, some of them were absolutely sort of obliterated, really. And these are really young athletes. Possibly some evidence of gastric acids there, be it through potentially eating disorders or GORD or something like that. But obviously we weren't sort of going to that level of detail of analysis and examination. But the patterns that we saw were, the palatal surface loss and that as well, which also highlights, the extreme pressure that these young men and women are under to perform at such a high level. Because, I think at that 16 to 18-year-old level, this is really kind of, for them, it's make and break. And it's such a low percentage. I mean, correct me if I'm wrong, I think it's less than sort of 1.5% or around about that actually then go through to becoming into first team. So yeah, so it was the findings were very surprising, but I must say because when as soon as we had the conversations with the sports teams, at no point, the staff just they got it straight away. The sports medics got it, the sports scientists got it straight away. We showed them evidence of what we were looking for and some of our findings as we're doing the screening, and they just took it on board and they realized actually this is a really important thing to incorporate within our overall player welfare and well-being and player management. And screening and clubs have followed up, want us to go back in and do pre-season screening as well. Of course, it's a very long, sort of slow process. As we know, schedules are extremely packed. There's, pre-season tours and matches. It's all sorts of things which are already being factored in. So we were asking for this tiny little sort of section, relative to all the other things which they have going on to be incorporated. And whilst, like I said at the start, as dentists, we feel it's the most important thing, right? We still need to have perspective that, we form part of the big picture. So yeah, so that was that. I mean, that's kind of like a bit of a summary of what we did and how we got to it and it's sort of the outcome.
I'd just like to touch on, so just you're a full-time clinician, you're in clinic all week. So I would like to touch on before we actually go into the research that you did, because what we're finding is I heard it quite a lot with fellow members of the Academy of Sports Dentistry in Washington. We're talking about how we need more research in sports dentistry. But I think a lot of the issues is that a lot of the sports dentists are full-time clinicians and they maybe don't know where to start from a research point of view. So whenever you're planning your research, what were the steps you did before you actually went out to collect data? Can you go through that just for other maybe sports dentists out there? Because I know there's some sports dentists that are quite active and they're looking to do research, but they maybe just don't understand, how to go about it. So from your own experience, whenever you were like planning this research, what were the sort of steps that you had to do before you actually went and did some data collection?
I think that's a great question because, to be honest, it's the first time I'd ever done this type of research before. And I think I probably went into it a little bit blindly and naively, thinking, okay, well, I've got this idea and we're just going to, apply for ethical approvals or write my proposal, be approved, done. This shouldn't take more than a few months and then I can just crack on. And actually, I had the idea and sort of ran it past a couple of colleagues and they were interested in it. And they were all also, again, full-time clinicians, and one was going off to study overseas and specialize. So I thought, actually, do you know what? Let me just put some thoughts down on a piece of paper. And actually, I remember having the conversation with Professor P. Fine on the boat, the river cruise in Paris, to the EA for us, European Association of Sports Dentistry.
Yeah, the very first. Yeah, it was the very first European Association of Sports Dentistry.
November 2019. Yeah, I remember having a conversation with him and kind of running the idea by him. And yeah, Peter's, it's, and I think I was very lucky to have somebody like Peter, and who was obviously very involved as a sports dentist himself and a researcher. So I think the first point would be, reach out to your networks, and, collaboration is key in all research. And I think it's really, really important to, if you have an idea, which you think there are legs to it, and then I think, it's worth exploring. And I did my research, and I was looking at, all the previous, and before I kind of really pitched it to anybody. So I knew I was going there with what I believed was a solid idea and solid sort of background research. As it happened, COVID then started. And so that put a massive delay on everything. But actually, it did give me the opportunity to write a proposal and go through the ethics approvals. But by having somebody as experienced as someone like Professor Fine, that certainly made the process a lot easier to navigate. So again, I think it's really, really important to, communicate with your colleagues, be in touch with, go to these conferences, connect with people locally, internationally, wherever it may be, actually, because, everybody has so many different experiences, and having listened to like these podcasts, for example, and 10 of the different events, you realize it's just We're doing amazing work out there in the area of sports dentistry. And there's a lot more people, I think, than we probably think are doing it. So initially I thought, there's only a handful of people, and they're just, a couple of people here in the UK are doing it, and a couple of people from the European social, but actually there's this whole network, as we've seen. And then, then it kind of got through sort of the process of ethical approvals. And then as a full-time clinician said, that's where it became a little bit tricky in terms of just the logistics of planning things. Because obviously a lot of it, the writing, I enjoy sort of writing sort of the proposals and the research. I found it quite fun and enjoyable, to be honest. First time I've really done something at that level of detail. It's super interesting. You just uncovering this whole new world almost. And again, like I said, my interest in sports as well as the dentistry. The actual putting it into practice is, I think with hindsight, it probably would have been good to have a slightly bigger team of maybe one or two people to help administratively, rather than kind of essentially just doing it on myself with Professor Fine. So it did require time out of work. It did, require just a lot of communication with the football clubs and logistics, and obviously I've got a young family as well, so you have to factor those things in. And as one of your listeners would know, people are doing MSCs or PhDs. These things can take over. And I think in my head, I knew as the process went on, actually, this was going to take a while. This wasn't going to be something be done in 3 to 6 months. Actually, it's going to take sort of a good couple of years, realistically. And I think it's just being realistic and understanding the reality, that is actually what happens in research, right? And as a clinician, we go into work, we see our patients, we do, and it's done. Whereas this is really a slow burner, as it were. But absolutely, it was worth every second of it. Thoroughly enjoyed it. I've learned a huge amount from it, and really managed to connect with a lot of people and different networks, and been able to sort of do things like this with yourselves, speak at a couple of different conferences about research and sports dentistry. And but I think it is a commitment, but I think if you've got a good idea and you've got the right people around you, it's just absolutely worthwhile pursuing.
I think in the research that you did, there was 10 academies that you went into. Was there more academies that you had reached out to who just weren't interested, or how did you approach the clubs to say that this is what you were doing? You had touched on it kind of a little bit early in the podcast, but how did you actually get in touch with the clubs and explain to them what it was you were trying to do and what the research was about?
So I was initially, there's an organization of the Football Association Medical Society, and I used to do quarterly lectures, and most of the lectures were, all of the lectures were on, Achilles injuries and hips and knees and various different football injuries. And it was all the attendees there were physios and medics and all the people you'd expect there. And there was a dentist there, a doctor there, Sean Carmody, who at the time was with QPR Academy and then went on to Crystal Palace. And he was just really sort of receptive to, when I spoke with him about, actually, this is, you discussed sort of sports dentistry and oral health. So I'd be the only dentist going to these things. And then I would gradually sort of network and just speak with people. And then he made further introductions. He said, well, actually, speak to this person, speak to that person. And he sort of opened up a network of clubs. Logistically, being in and around London where I live was always going to be the most sort of convenient in terms of being able to access. So initial introductions were made. And then by this point, I had a proposal signed off with ethics approval to the Eastman Dental Institute. And so I had sort of some real sort of something solid to back me up, as it were. And I was connected to the sports medics, the sports physios, the academy, head of medicine for the academies, had conversations, sent a proposal, and they said, this sounds really interesting. We'd love you to come down to the clubs, screen the players. There's consent forms and everything has been done, anonymously, and data protection, of course, as part of the proposal. And then it was just really a matter of organizing logistics. It was all self-funded, the research. We did have our single-use dental instruments company, they actually donated the mirror probe, and that was essentially all we got provided, which was great of them to donate that. But other than that, yeah, it's just sort of self-funding and coordinating with Peter and myself days off and with the clubs. Again, because it was during COVID, that was quite tricky in terms of access. And from the very start, we still needed quite strict COVID protocols and a lateral flow testing and things like that in order to do things. And then as we carried on, it was a bit more, a bit easier. So yeah, there's a lot of logistics into it. And of course, before we can even step on site, we needed consent forms to be signed by the players or their guardians. Again, this was all stuff which I sent to all the clubs beforehand, but very meticulously detailing this is exactly how long, because they said, right, well, we've got 25 players in a club, for example, and you've got 3 hours, or here's your time slot on this day. So essentially we allocated, it was about 12 to 15 minutes per player at each screening was roughly what we had. They were sent the questionnaires beforehand. They were sent the consent form beforehand. Everything was really well organized. The clubs were amazing. They had everything, all the players lined up, ready and waiting for us. Yeah, it was a bit of a logistical feat, not going to lie. So now I have an even bigger respect for, people who go and do these things on sort of a mass scale. And I know, John, obviously you guys, when you're doing things at, say, like the Olympics as well, and just, working such a huge scale.
Were you carrying out the physical examinations in like a physio room or in part of the stadium, or where was it you were doing these? Yeah. Can you give us a little bit more information about what sure. that was, so, and also what equipment you were using? Were you using loops, and how were you recording your notes, all that sort of stuff?
Okay, yeah, great. So good question. So we were on the training grounds, the academy. So some of the clubs, academy ground training centres are on the same site as, say, first team. Some are split. For example, say Tottenham Hotspur, for example, they've got sort of the first team on one side and the academy on the other side. So we'd go in, they gave us a physiotherapy room. A couple of the ones they got like teaching classrooms, which there was a couple which were like a more porter cabin, for example, but there were physio tables which were there. So this was our request. We needed ideally a physio table and literally just a table so we can lay our stuff out on. We were providing everything else. So we were providing our own sharp spins, our own cross-infection, our bags for clinical waste. So we'd go in, we'd set up, have our chairs. So a couple of them we had, say, 2 chairs side by side. So we each brought a nurse with us. But the 8 of the 10, we actually just nursed for each other.
And for each other, you mean you're talking about Pete Fine here? You and Pete?
Sorry, yes, Professor.
Yeah.
And then we'd obviously gone through our protocol beforehand and made sure that we'd done training beforehand to make sure that we were consistent with what we were identifying and like our ICDAS scores and our BPEs and making sure that everything was consistent. And we literally had our charting sheet on the side, and there was an outcome form. So each player had an outcome form. So let's say, for example, it was whatever club it was. Player 1 had their questionnaire, which was player 1, and then on their outcome form was player 1 outcome form, and on the charting was player 1. So everything was, of course, anonymized. The only thing which did have a name, and that's what stayed with the club, was the actual outcome form, so that the club could then follow up with players if there was an issue. So they could identify them, which we went through with them personally afterwards anyway. So we had that all lined up. We had all of our our cotton rolls lined up. We had our mirror probe lined up as well. Had our loops with with lights as well. I mean, most of the areas were quite well lit, but of course, that was a specific thing. And then we essentially had our allocation of time, and we would do it. And then one of us would be doing the screening, the other would be writing down the notes, and then we would swap. But we would also be cross-referencing and checking with each other to make sure that we're calibrating throughout the entire time, which took an extra few seconds, right? And although we were limited in time, it's something which was very important to make sure that we were consistent with everything. And yeah, so the players would then come in. It's difficult, you've got 16, 17-year-olds, men and women that don't really, they're busy, they're training, they don't work 3 hours. So sometimes it got a little bit loud and noisy, and we did actually. I mean, this is just the practicalities of it. So for your listeners, they know actually maybe we would have had them say sitting outside or doing something, and say right, can the first three come through, and so people aren't waiting. Because also, I think we were very aware of not wanting to waste their time, and make sure that we were super, super appreciative of the time and effort that the clubs had put into organising this for us, knowing how busy their schedules are and how much they have to fit into a week and training, etc. And so, yeah, so making sure that that was all organised. And then, yeah, just the players would come through, they'd sit down, we'd do the screening, we'd have a little chat with them as well. They would have done their questionnaire before, put it on the side, pile that up, and then just go through the screening. We would have, because it's a screening and you're very limited, and we had sort of full checkup, take a full history. You want to sit down there and have a full conversation about their dental history and hygiene and diet, etc. And that is, of course, by the limitation of doing these types of screenings. It was always reinforced. This is a screening. You still need to be seen by a dentist, okay, in a dental practice for a proper dental checkup. Again, this is all part of information which we discussed with the clubs. So the players would then come through, they sit down, would write it down, go through them one by one. And at the very end, we had them all piled up and we had them all lined up, and we would go through with the sports medics any recommendations. So, for example, player 3 at whatever club, everything's fine, just needs to improve their brushing or flossing. Player 7, actually, there's a lot of tooth wear and, potential gastric or parafunction, and recommend, needs to see the dentist to discuss potential mouth guards, canine build-ups, just things like that. So just giving them an idea. But again, this would be written down in brief, so they had something to go by to then go back to take to their dentist. Because they're 16 to 18 years old in the UK, for your UK listeners, they're eligible for NHS dental treatment or free NHS dental treatment. Of course, I think we're, cognizant of the fact that it's difficult for players to get access to dentists because of waiting times, etc. And this is very much straight after COVID, a lot of this. So things is a massive backlog there as well. But I think that was just important so that they're aware of what they are able to access, and clubs are aware as well. And yeah, highlighting, there were some which were, for example, there was a few players which had 3 or 4, 5 grossly carious teeth, coupled with actual abscesses which were in pain on the day of screening as well. So that needed to be addressed, sort of flagged up as these actually need to be seen quite urgently. It's not just they need a hygiene. This is, if you leave them, they're going to, this actually will impair their performance. And if it wasn't already, which some of them had obviously told us that it was. Yeah, and that was the logistics of it. I think the clubs, and then again, it's just following up, just from a practical point of view of these types of things, just making sure that the clubs, just to thank the clubs actually, and thank the players. And I must say, all of the players were extremely respectful, like when they were with us, and very polite. And again, I've reinforced this to the clubs because I think it's important that, these players are being assessed, not just on, of course, their sporting, skills and their athletic performance, but in terms of their general, behavior. And I think that's something which I thought, just as a, a good professional thing, just to have a conversation with clubs about. Followed up with the clubs afterwards, again, thank them. And yeah, then a number of clubs said that they wanted us to then come back and do screening. And then it's just a matter of factoring that in. That, of course, isn't part of the research. That is an additional thing. So if people do this, then that's when you have that conversation of, okay, great, we can do that. But actually, this isn't part of screening now. So this is something that actually potentially is chargeable. So that's another sort of conversation. Just as a clinician, I'm now doing this as one part of it is research, and now actually the other part is part of my day job, essentially. So it is important to have sort of a cutoff there.
So see your screening days, were they linked in with other screenings? Like say it was like a medical screening day and they were linked in, or were these independent screening days that they were just inputted into their normal routine and then they were pulled aside?
Yeah, a couple of them which we did throughout, well, a few of them which we did throughout the summer months. So was end of season, pre-season. Yeah, they were having, say, a screening for other things, either like over a couple of days. So it actually worked out really well. And then a few others, the rest were mainly kind of throughout the year. when it works for the diaries. In an ideal world, and this is, I think, is where it comes down to like the crux of it, like what we want to get out of the screening and out of this whole, from an oral health perspective certainly within football, but obviously other sports as well. But football specifically, incorporating oral health screening as a prerequisite, as pre-season, as part of their overall screening, like you said, John. So, they're having their cardiac screening, their concussion screening, all their other assessments which are being done. Dental should be part of that. And, per player, it doesn't require a huge amount of time. But if you've got a squad of 20, 25 players, that is a big allocation of time to give to us, right? Which is difficult. But I think that also reinforces the point that, it's just a screening and it is a quick overview essentially of what is clear and obvious, grossly cavitated teeth and, really inflamed gums. We're not taking any x-rays. We're not doing sort of full occlusal analysis or assessments. We're not, taking full histories of the trauma, different things like that, which is why routine dental checkups is critical. And again, these are things which we reinforce the clubs and, we include as part of our write-up and initial proposal as well. There are guidelines based on risk levels as to our recall intervals. And some of them, may need a 1-year recall. Others certainly needed 3-month recalls. But the only way to determine that really is by having a proper dental checkup. And as an individual having a recall throughout the season, that is a doable thing. That is logistically that can be factored in. We're not asking them to take half a day out. We're asking for local players to see a local dentist and hygiene, for example. So, and I think that's, part of the bigger discussion, really.
So the days that weren't part of the screening, so what was like the academy normal training week? Do they train? It's my understanding with the professional footballers, a lot of them will train in the morning and stuff, but do they go to school and then they go, or are they full time? The 16 to 18-year-olds, are they full time?
Yeah, so there were a couple of the academies we went to, it was interesting actually seeing how it worked with the local schools. For example, the players were coming, more than were like the 14, 15-year-olds were coming from local schools, which we saw, but the clubs were responsible for replacing those hours missed of education. And there is a whole sort of system in place from what I gather, in terms of like a tier system, I think, in terms of the different clubs which they're in. But it's almost a one-to-one tuition in the couple of the clubs. I think, the players were having to do, I saw a couple of players sitting there with one tutor and they were going through their coursework or whatever it may be for school. So it's very, very obvious that the clubs are invested in the local community. Like, it is really, really very clear that, we are looking after, because I don't want it to come across like, we've published this research and there's high levels of oral disease and actually players are being neglected or anything like that. That is absolutely not what we're trying to highlight, because it's very clear that the clubs put a huge amount into looking after their player welfare and well-being in all the clubs that we went to anyway. And it's really obvious. So yeah, but they do, there's a lot of training and they have to factor in school. They're still there and throughout the day, and rest is obviously important. They're in the same way these guys are, and girls, men and women, 16, 17, 18-year-olds, they still want to be 16, 17, 18-year-olds, right? But you can see they're very focused, very, very focused.
So what sort of time window then did you have availability? Was it like after their training or during the training? Was it in the afternoons or evenings or mornings? What sort of window did you have on the day then to get access to them?
So we would go, mainly it was the morning, but they've given us time slot, right? You've got a morning slot, you've got an afternoon slot. They've just had lunch or they've done a morning training session. They're going to come and as they're getting changed, the ones who are trained will then come into you. So we never had to wait for any players to sort of come and get ready. So there were some maybe who were injured, so that we'd prioritize them. So the clubs had kind of organized it for us to say, okay, well, these players are injured, they're ready, they're not training today, they're going to be your first 5. And the others, they're all coming off now. So by the time they're off, and some of them won't be changed. So they're just going to get on, or, sweaty and muddy, whatever, just crack on with it. Others will just use the opportunity because if they're further down the line, they'll go and have they'll go get changed and they'll come to you afterwards. And yeah, it's just the logistics of that it was very much down to the clubs actually making it and allowing it to happen, which they did. And I think we're really lucky. I think also, actually the clubs are so well organized and so well oiled. There's so much structure in place. You can see, and there's webinars and there's workshops. So for example, we did a couple of webinars for the sports medic teams and did education talks for some of the players as well. Again, this is other stuff. That's another sort of side of the outcomes of what we identified. But yeah, it's just, and just actually to come back to your original point, we approached 14 clubs. Sorry, I detoured. Sorry. We approached 14 clubs. We had 10, and the reason why those other 14 was not because there was no interest. It just came down to the logistics and the practicalities of getting the time in the diary. And we needed to call a cutoff point from our perspective. Otherwise, we just could have carried on and on and on. So we just called a cutoff point, and it's not through lack of trying, but it's sometimes it's just the practicalities. It doesn't always work.
Yeah, I mean, you did the screenings as part of the research. Obviously, you were full-time clinician as well, so you're having to take time off work to kind of do this. But in that time, you've obviously identified several players within that who had some sort of issue, whether it was caries or gingivitis or periodontitis or something. If we're able to then highlight these athletes at that age to the clubs and say, look, there's an issue going on here, that's going to save them time, effort, and money in the long run. So yes, you were doing it as part of the research, probably weren't getting paid for it, but as we look forward for people who are keen to do something like this, who want to get involved with their local community, with their local clubs, because not just talking about football, we're talking about any sort of athletic clubs around. If there needs to be a price on it to a degree where you are covering, even if it's just covering your time and your costs initially, and you can propose to them to say, look, there is these research papers that have been out. Yes, they're mainly focused on football or soccer in the UK here, but there's evidence to suggest that something needs to be done. So in the long run, if we're able to identify something now, we're able to fix it at an earlier date. It's going to then, you're going to be more profitable as a club or as an athlete going forward because you're identifying it earlier and doing that. Because it's all very well, we talked about just before coming to the podcast, how in sports dentistry, there's not a lot of money into it. We're doing it for the love of it, and there's a lot of our time that we're having to use. Obviously, there's perks of the job as well that we do get. But as time goes on, we do need to look at it and okay, how can we rephrase it and reword it to these big organizations and clubs to say, look, there's actually an emphasis that needs to be put on it, along with our sports medical colleagues, our physiotherapist colleagues, our nutritionist colleagues, who I'm sure will, to a degree, would be getting some sort of financial, I'm not even going to say benefit, just financial break even to a degree. So I think that's because I think we need to look at that as well, because people will lose interest. And we've had guests in the past who say they come in, people who are enthusiastic about sports dentistry, they hear the word sports dentistry, they just want to get involved. But then they actually look into the logistics of it and they think, well, actually, I'm having to take time off work, I'm doing something, I've got a family, how am I meant to take the time to spend between my family and doing this and that? So we need to be able to give people an opportunity to realize what sports dentistry is about, but also how we're able to break even from it, not even profit, just break even from it to a degree,
I mean, this is, maybe I have a very sort of altruistic sort of perspective of these things. And I think I look at it, and this is maybe also where I put my sort of health policy hat on, because I look at it as this is a real opportunity to make a significant change to the sort of sport, right? And, prevention is better than cure. We know this. And we get into dentistry because we want to help our patients and we want to help communities. And I think we just need to look at this as another community, right? It's the sporting community. And we want to, and at the risk of sounding like so idealistic, you really genuinely can make a change and make an improvement. even if you're working with one club, whatever sports that it is, football, soccer, ice hockey, whatever it may be, athletics teams, because, if you can impart this knowledge on the sports medics or the trainers or whoever it may be, that, the mouth is part of the body, right? We need to put the mouth back into the body, which is a message which we as dentists know, and we've heard it, that sort of mantra many times, but maybe others don't. If we can make them understand, well, the bacteria doesn't just stay on the gums, right? It's in the circulation. And once it's there, we know that there's research showing association between periodontitis and cardiovascular respiratory, even, being picked up in patients who have maybe had severe Alzheimer's, so once I think you have very frank, sort of it's only a basic conversation that if you can improve the mouth, then you are improving someone's general health and well-being, and ultimately can improve potentially their sporting performance, or you can prevent there being an impact on their sporting performance by, making sure they don't have an abscess which explodes the night before the sporting event. Certainly at the elite level, they get straight away because it's 1%ers, right? It's such small margins between winning and losing and coming first or whatever it is, or being able to train. If you're off your game ever so slightly, that is the difference. And it's, we've just, like we were talking about before, the England women's team just won the Euros, right? They're performing at such a peak, such a high level. If there is a dental issue, if there's any issue which they're not quite performing, that can affect their performance, and that is the difference. So I do think that, I guess we have a responsibility as clinicians to be helping our patients. If your patients happen to be part of a sports team, then actually, do you know what? And you like sport, then that's actually quite nice, right? Because I enjoy sports, so it's nice to put it into, like I said at the start, like a hobby. From a financial point of view, to address that point, yeah, I totally get that, and it is difficult to come up with, say, like a figure which is fair and respectful and not deemed to be seen that you're, maybe, if you would say, a bigger club, like trying to take advantage of bigger clubs so there's more budget, because that's not necessarily the case, right? Budgets, although there's lots of money in different, I'm referring to football specifically, but there's budgets are allocated, right, very, very tightly for different departments. So I think it is difficult, but I think you also, that is your worth as a clinician, and there's nothing wrong with making your local team aware. This is the, whether it be a day rate or it covers the costs of your administrative staff, or maybe you need a nurse to come with you, so you need to make sure that your nurse's day rate is covered as well, and you factor that in. But I and even going, that's from the screening point of view, but going and doing, say, workshops, like education stuff as well, you also then start to build up like a rapport and a relationship with the local clubs, which then, patients may then come back to you for treatment. Okay, that's not why I'm doing it personally. That's not why we're doing this research. They're 16 to 18-year-olds. They are absolutely can go for free NHS treatment. There was no financial incentive or anything there at all, which was very, 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 very important for me to emphasize at that point. But I do believe that you can affect an entire club, an entire community, by imparting your knowledge through screening and education there. So, yeah.
Just talking about the learners, I think there actually may have been a dental trauma incident in the last few minutes of normal time with one of the centre halves. They were going for heading for the ball, and I think the back of one of the Spanish girls' head hit her in the teeth. Now, whether she was trying to waste time, but she was holding her teeth. You could see on TV.
Really?
Yeah, so we've had this conversation with a few other guests, particularly with the next World Cup, Men's World Cup next year, and FIFA's decision not to have a field of play sports dentist at the games. It's interesting. But with your research, it was more about the oral health and the oral health aspect of the athlete. So as you said at the start, you found that the oral health of these academy soccer players were at a poorer level than the general population at their age. How do you think us as sports dentists can address that, and what sort of measures can we suggest and work with clubs to prevent that being the way where we can actually change that to where 16 to 18-year-olds that they've already come through an academy system. By the time to get to 16 to 18, that their oral health is actually at a really good level.
So I think, just to come back a little bit to your point about the trauma as well, we also did identify about 30% actually of the players had some kind of dental trauma to the anterior teeth. Not all of them could remember where, but a number had associated with during training or before competing. And it seemed, and this is more sort of anecdotal again, because we couldn't take full histories, but it did seem quite clear that there was no obvious dental traumatology guidelines followed in terms of follow-up for a number of the players who had suffered trauma. There were some that there'd been trauma and there was, that had needed an endo or a root canal, for example. But, in terms of recall and reviews of dental trauma. So, yeah, it's interesting that you say that with regards to next year's World Cup. But also that does form part of your next point in terms of what can we do with clubs, specifically football. And I think there is a lot that we can do. I think engaging and collaborating and, education from both sides, right? So us understanding, the different aspects and the nutrition side of things, because we're not there to be nutritionists. We're not there to say, don't have, this, because these players and these athletes need to consume a certain amount of carbohydrates and etc. for their performance, right? And they're going into, whether they might be having gels, if it's whatever it may be, the latter stages of matches. But it's important for us to understand how things work from their side. We can't just go in there and expect everyone to say, oh, well, great, okay, well, the dentist has come in and the sports dentist come in and we need to listen to everything they say. That's not realistic, right? There's many, many factors and parts and people as part of it all. So we need to understand their side of things. But I also think it's an opportunity to bring dentistry into the overall sports medicine setup at clubs and sports organizations in general, to understand the importance of oral health. And I keep saying oral health, not dental, not dental health, because it's the whole thing, right? It's the whole soft tissues and everything there as well. So I think that's an important thing, because I think there's probably a misperception that we're just there to kind of talk about dental trauma. And I think it's really, really important that they know it's beyond that. There's gum disease, there's tooth decay, there are occlusal issues, there's TMD, there's lots of things. The tooth wear, like I said earlier, which was a really surprising finding. So bringing the sports dental team or sports dentists within the wider sports medicine team as like an integrated approach and a holistic approach, really, I think is the word, which I think is probably the right word. So that, there's an holistic, like in the same way when we look after our patients, right? We don't treat teeth, we treat people. And, there's a person with a life, with the family, with a job, with stresses attached to those teeth. And we need to factor all of those things in when we are assessing, diagnosing, treatment planning. And I think that is the same when it comes to sort of athletes as well. We need to factor in all these things, all the different factors. So, it's all very well saying, well, there's not the tooth way, give them the mouth guard or build up their, anteriors, whatever it may be. But actually, there's a team psychologist are involved, or there's the nutritionists involved, or there's could be some trauma, or, whatever it may be. So there's various things like that. I think also in terms of other things that we can do, our role in terms of doing education. So I mentioned before, we've done, so Peter Fine, Professor Fine, we also did some education webinars. It's always possible to go. You don't always these days need to go in person. It's always very nice, don't get me wrong, to go and meet people face to face, but you can do a webinar. We did them with the whole sports science teams and some clubs were very receptive and found it very, very helpful, giving them guidance, giving them advice, directing them to oral health resources and, recall protocols and all these things. So they were up to speed, because they're not expected to know dentistry. They're not expected to know sport. We all have our different specialties, but then also doing things like education workshops for players as well. And all the clubs that we went to anyway, they have, in addition to their screenings and things like that, there are workshops on different topics for players. So I think there was one which I went to, they were talking about, it was like insurance, and one about setting up, like if you're renting an apartment or a flat or buying a house, whatever it may be, just, just kind of life skills, right? Because these are 16, 17-year-olds who will be at that stage, and they're under the sort of the care of the clubs. And then again, they brought dental into that, and we did some talks. So again, and I think it's reminding them of the role that we have as dentists to help their players ultimately be healthier, fitter, not compromise their oral health and their general well-being and their sporting performance. I think there are also a number of other issues which fall outside of an individual club, which are much bigger than a club. And I think you have sports organizations, so for, let's say, the FA, for example, or wherever it may be, or who, if there are guidelines which are coming from a top-down approach, so be it FIFA, UEFA, the FA, Premier League, or whoever it is in the respective countries, recommending that oral health screening be included as part of pre-screening, part of pre-season. Because at the moment it seems like it's more just clubs making the decision individually, right? So it's if you've got it coming from the top down, then you're likely to have more buy-in.
Do you know if the medical screening comes from top down, or is that club?
Yeah, there's strict guidelines with regards to, say, concussion and cardiac screening and things like that, which we know of. In terms of all the different parameters which are screened for, I mean, I couldn't say, but I think it's so well established from the sort of athletic performance and medical screening. We are essentially relatively new part to this, and so understandably things aren't in place yet. But I think that's what we want to try and achieve, and that things like these podcasts, the networks, the sports dentistry, the conferences, all of these different things is making not just dentists aware, but having non-dentists participate in these types of discussions, right? So that, because we're already converted, right? We know what we want to see happen. But then I think, in addition to sporting authorities, say, giving guidelines or guidance or recommendations on what they want clubs to roll out, you then have sort of bigger picture in terms of, well, if a number of these players, and we didn't screen for this, but anecdotally, we didn't look at sort of socioeconomic backgrounds, but anecdotally, football players, from what we were told, from sports medics, etc., that they are generally coming from sort of more socioeconomically disadvantaged backgrounds. So therefore, potentially their sort of the health inequalities that exist, and dental being one of them, that people from, say, lower socioeconomic backgrounds are more disadvantaged when it comes to access to dental screening, dental care, diet, things like that. So they're already coming into an elite environment. So our DMFT, for example, decay missing filled teeth, when we're looking at that as part of the screening, was very high. But that is not solely because a lot of these players had loads of decay, but actually there was a number that had previous missing teeth or filled teeth because of experience, right? And has this happened just while they're playing elite football? No. Is it because of backgrounds or access and things like that? Well, that's a bigger national policy issue, right? In terms of, there's things like sugar taxes in the UK, which have been put in place, and, I know fizzy drinks, energy drinks, restrictions on that, but education for early years to get a good understanding and education on the importance of oral health, diet, dental attendance, and good positive attitudes towards oral health from an early age can help set these players up to good positive outcomes ultimately.
Yeah, you make a valid point. It's very much a multidisciplinary approach, and we've mentioned that a lot of time in the podcast, that we are just one part of the puzzle. So we need to be able to communicate well with the other sports medical colleagues, because that's the only way we're going to be able to help make a difference. And the research that you've done here, we will put a link to the paper so people who are listening to the podcast can actually read the paper, and they can go into the logistics of it and the findings of it in a bit more detail as well, so that they can do that. But if we can use this sort of research and ones previously by Professor Needleman, and we can approach the clubs. I think that's the best place to start, and I do believe that as time goes on, it's more about how we can influence the sports medics and our colleagues. That's what will make the change about then bringing us into the bigger picture. And I think if they can see that we are keen to help and we're there, because we do want these athletes, that's the whole point, is we want them to perform well, we want them to get better, we want them to succeed, because again, many of us sports dentists have some sport that we play or that we enjoy being involved in, and we want to see other people succeed. Certainly if it's your country. But for me, obviously, I want the Scottish athletes to do well, and if they do well, then they'll do well for Great Britain and all that sort of. So it's kind of, you have that affiliation with it as well. So it's always good to kind of see if you can have some part to play in that. Then that's fantastic.
Yeah, I kind of echo that. I think it's nice to be part of the community, the healthcare community. Actually, that's what we ultimately are, right? We're healthcare professionals, and I think your question at the start was, how does one go about getting involved in these types of research? I sort of mentioned, like, collaborating with other dentists who do this sort of research, but actually collaborating with our fellow healthcare professionals across the sports medicine world. And, even now when we go to these conferences, sports medicine conferences, not just sports dentistry conferences, to see a few more dental lectures, and lecturers and webinars and workshops, etc., being included in these, big sports medicine conferences. It's really encouraging, and I think it's a really positive step that clearly it's been recognised the importance of oral health on an elite athletes, and hopefully, like I said, collaborating with our colleagues across the healthcare spectrum, I think is key, and that's the way we sort of make progress and sort of make positive change in this area.
Yeah, that's great. So that's been fantastic. So we've had a good chat. Would give us a good hour of your time. We try to keep everybody to an hour. We don't like to take up too much of people's time. So that's fantastic. And the research, it's got a lot of attention. It really has brought eyes on sports dentistry, which is fantastic. So the fact that I'm sure it was a nice satisfaction to see all that hard work come together, and the response that it got from as you said, it first of all started away back in 2019 with an idea, and it's took to 2025 to get it published. So I think that's an important point as well for any sports dentist, particularly somebody that's not in an academic role, that's a full-time clinician and they're keen to do research. I think that's an important part, that it's not something it's not a quick fix. It's not something they can do. It's took you 6 years of hard work to come up with a fantastic piece of research that's been very widely recognized as an important piece for looking at the oral health of these developing athletes.
Thank you. No, I appreciate that. It's like I said, it's very, very, very rewarding to have done it. It's great to be part of the team, and my colleagues as well, to kind of help you, because we don't do this on our own, right? We do it with our colleagues and our people who support us. So that's really important. But thank you. I appreciate being included on this, because you've had some fantastic guests, and this is a great podcast. So it's a really interesting podcast series which you guys are setting up, and look forward to listening to many more.
Yeah, no, thanks for coming on. So that was really interesting. I think again, it's a guest who's got a completely different aspect of sports dentistry that we've not heard of before on the podcast. So it gives people an insight, and if there are other clinicians who in their respective countries are trying to think about doing some sort of research as well, I'm sure they'll be able to reach out to you. So we'll obviously have Saul's information here, and if they want to reach out to you and see if there's anything that you could help them with, that would be fantastic as well, because it's very much what we've said on almost every podcast, is that we're here together to try and build towards Cancun, trying to build towards something bigger. Who knows where that leads to yet, but we need to be the ones who are providing the platform to, I don't mean we as in the podcast, I just mean we as sports dentists, providing the platform to continue to grow not just here in the UK, but certainly worldwide. And it's people like yourself who make a big difference, and other guests who come on as well. So yeah, thanks very much. It was fantastic having you on, Saul.
Thanks, guys. And like I said, yeah, more than happy for you to people to reach out if they need any, want to collect and collaborate. Yeah, pleasure. Thank you.
That's great. Thanks very much, Saul.
Thanks, Saul. We are delighted to have Ionate as a sponsor for the Sports Dentistry podcast. Are you looking for a water bottle that's built to keep up with your active lifestyle? Look no further than Ionate, the totally leak-proof water bottles with triple lock technology to prevent spills no matter where you're headed. With a simple one-touch opening mechanism, you can sip on the go without hassle. Plus, Ionate's sleek, modern designs are not only functional but can be personalized just for you. Made from high-quality steel, these bottles are easy to clean, and best of all, they're sustainable. From 320 mils to 1200 mils, Ionate has the perfect size for you, whether you're just out for a jog or going on a long hike. And it doesn't stop at water bottles. Ionate also has travel mugs and flasks to keep your drinks just right wherever you are. Ionate is the official water bottle supplier to the British and Irish Lions on their tour to Australia this summer, and are the official water bottle supplier to the NFL, so you know you're getting the best. I have been using their bottles for a long time now and cannot recommend them highly enough. So head over to www.ionate.co.uk to get your hands on the best bottles in the business, bar none. Now back to the pod.
That was really interesting. Just want to touch on a point, first of all, is he was able to explain the importance of networking at a conference, because it was on the conference dinner of the European Association of Sports Dentistry that he first started talking about the idea of doing the research. So for anybody that was in two minds about coming to Manchester, come to Manchester. It might start a 6-year project into research, looking at the oral health of a group of athletes.
It just goes to show you just how important networking is, just how important it is, what it can lead to, what that conversation can start. And yeah, like you said there, that was something that just, he had a discussion, and then before you know it, 6 years later, it's now being published. But that you've said this many times on the podcast, is it's when you're at your most relaxed, you've had the CPD and you've listened to all the lectures and you just get to unwind. And it could just be off the cuff comment like the Sports Dentistry podcast was last year, and look where we are now. We're almost 20 episodes in. But I think a couple of things I wanted to touch on from the research was that there's still a high number of athletes, young athletes, who have got oral disease. And, we're looking at 31% having caries, almost 77% having gingivitis, 22.5% having periodontitis, and 21% of them saying they've not attended the dentist in more than 2 years. Now, I don't know whether that's because it's a COVID thing or not. Obviously, we know that in the UK with NHS, they're looking at doing yearly checkups. So what's your take on that? What's your thoughts on those numbers that I've just read out there to you?
Well, first, it shows the need that we need to address this in some shape or form. The other thing that I found quite interesting is where Saul was able to describe some of it, obviously his background before he got into dentistry and his ability. I think it was a master's in healthcare, and how the way he was looking at it from the social economic background of some of these athletes. And that's maybe quite an interesting way that we've maybe not looked into a lot, is like certain sports, is there certain athletes from certain backgrounds more likely to go into certain sports, and is it them sports that have got a higher risk of poor oral health that we maybe need to put a little bit more focus on? So that was quite interesting, the way he was sort of describing the sort of problems that have maybe led to what he was seeing in the screening. But it definitely showed you the need for intervention, didn't it?
Yeah, I think so. It shows the need of intervention at a young age as well. We're looking at 16 to 18-year-olds there, and if some of them are saying they haven't been to a dentist in more than 2 years, I know when I was younger, when I started to get lunch money or pocket money from my parents, I would then go and spend it at the tuck shop. Tuck shop being where you'd buy sweets and you'd buy kind of crisps, or at lunchtime we would run down to the main street, and you still have these shops. I don't know if you've got them in Ireland, but here we had these shops where there was the jars. You'd have 100
Yeah.
different jars with all the sweeties in it, sherbet sweeties, sticky sweeties, fizzy bottles and all that sort of stuff. And back in the day, if my mum would give me £1.50 for lunch, I could get a lot of sweets for £1. And I never, I suppose for me, I didn't really have much of a sweet tooth, so I'd maybe get a few things, but I would probably get crisps is probably what I would normally get, or chips as they call them in the US. But I would get more that side of things. But I can see where these young players, if they are playing at a high level and they're training a lot and they're, some of them are still at school or they're leaving school and they're going to more of a full-time contract. If they get some disposable cash, disposable money, they're probably going to be spending it on things like high sugar juice drinks, Lucozade, Gatorade. There's other ones on the market and also sweets. And they have got a lot of downtime. And we know with working with athletes, they do have a lot of downtime. And if they're playing computer games or whatever else, then their oral health is going to take a hit. And we need to kind of educate and intervene at a younger age. I don't think we can tell them not to have this stuff because you only live once. You need to enjoy yourself, yes. But at the same time, you can still enjoy things within good limit.
Yeah, I think there needs to be that sort of educational speak that like they're obviously going to have a lot of nutritional stuff, but maybe it's not as focused at that younger age where the nutrition, and even it depends sometimes in the sports. Some athletes will be very strict and they'll follow the nutritionist, and some athletes will do their own thing. I remember years ago watching, and I'm sure it's changed a lot now, but I remember watching it was on TV, BBC or something, and it was like the cameras are in with one of the premier teams and they're talking about after training because they've spent so much energy, they're eating a chocolate bar to get, to recoup that energy and stuff. And you can see how maybe the younger athletes that maybe aren't fully aware of their nutritional aspects are coming in after training and they have that, they're maybe looking at sugar sort of hit from like fizzy drinks or chocolate bars or something like that there to try to give them a bit of energy back from training. You can understand that aspect, but I always almost think them as well that I used to see it a lot in clinic that you'd find a lot of people maybe that hadn't been the dentist for ages come in to you in their late 20s or early 30s, and they would say, oh, they've started to get a bit of a toothache and they haven't been the dentist in years. And you'd find as soon as they leave mum and dad's house and they start getting a wee bit of independence, that all fell the wayside and they didn't actually, there was actually no focus on their oral health. And it was only when they first got a little bit of pain they decided to get back into the habit. And by that stage, they maybe needed 8 to 10 fillings, but it was only one of them was at a stage where it was giving them pain, but the rest of it had been developing over that time. And it's possibly something like that. A lot of these young kids are maybe going into the academies and they've got this wee bit of independence and stuff, and the focus isn't really there on that oral health. But it shows that we need to get that intervention, working with the medical teams to try to get that intervention early. Like we've spoke a lot in the past about working with elite athletes, but as you said, this research shows how the importance of maybe looking in as a step sooner. And we've got to maybe look at it from the aspect that a lot of these young kids are not going to make it at the top. But the same way as how the clubs are focused on their education, they're giving them life skills, they're getting them educated, they're making sure that they're getting their GCSEs, etc. Like getting them to know how to look after themselves from an oral health perspective with good oral hygiene routines and how to make sure they're going regularly to get things picked up. That's a life skill. It's not just because they're an athlete. We're providing them with life skills to look after themselves from a health point of view. And maybe that's the aspect we need to come at it from it. Yes, there is that evidence there that's showing how poor oral health is impacting their athletic performance. But we want to look at the bigger picture and say a lot of these kids don't make it. We're still providing them with a life skill that's going to keep them in good health from an oral health and the impact that has on their systematic health as they get older through life.
Yeah, 100%. And as you said, we do a lot with elite athletes, but actually I think it's even more important to target the youngsters, and that's the sort of age, when we know like all your permanent dentitions should kind of roughly come through kind of 14, 15-ish. So, that's even earlier than that is where you probably need to start targeting it when they're kind of 12, 13, 14. And then, like you say, when they get a little bit more independence, and, my 6-year-old is honestly like she's 16. So I don't know what it's going to be like, when she's 12. So I can only imagine what these kids are like when they're like 12, 13, 14. But I think that's the sort of age where they're coming into their own, they're getting a little bit more independence, and that's where it becomes even more important, I think. And you have to relate to them at that level. You can't be seen to be going in and be like, you must do this, you must do that, because that does not work. It's just about saying, right, okay, just giving them pictures to look at and to try and tell them a story, because they've got short attention spans. Like, if you don't do this, if you do this, then this is what could potentially happen. You just show teeth of like abscesses, or you've taken teeth out and they've got big holes in them and stuff like that. I think that I suppose will register them with more into their brains, and it would be then you just sit them talking to them, be like, this is why you should, because nowadays a lot of kids, obviously, we've got tablets and they've got things that they can look at on their phones. They're more photographic, I think. So if you can show them something visually, and you can say, right, this is what we want to be focusing on because this is what could potentially happen, and they'll kind of sit up and take notice more. But you need to get to their level, and I think from what Saul was saying in his conversation there, he said a lot of the I'm calling them kids, but they're 16 to 18. A lot of the kids that were there, they were all very respectful, and they all kind of, acknowledge what Pete and what Saul were trying to do. And that's really good to hear as well, because it means that they're receptive to, and being open to what was being done and what was being carried out, especially in football, where I don't deal a lot with football here in Scotland, but I know some of our colleagues do. I found them quite difficult just to have that engagement with. But it was actually really nice to hear that about those 10 clubs that they dealt with.
Yeah, I think in the club environment, and especially if it's a club-led thing, the players, especially that age, are going to buy in because they're going to do everything they can to make sure that our club signs them on the senior contract.
Yeah, that's true.
So that's where we kind of need the help from these clubs and these academies for this intervention, because it's more likely going to get a buy-in if it's led through the club than if it's us individually talking to that athlete in the dental clinic. They may not just buy into it as much, but if it's a club led thing, then you can see how they would buy into it a little bit more.
Yeah, no, that I agree, because I think they're just going to do what they're told at that age, because like you say, if they're looking to try and get a better contract or get a professional contract from that side of things, then you kind of just go with the flow, and it's important that we can help facilitate that. If there's something that they might not want to tell the physio or tell the medic that they've got an issue, they might then tell you not in secret, because that's not what I mean, but if they tell you in confidence, like, okay, actually, I'm glad you're here because I've actually got this underlying issue that I haven't been able to get dealt with because, for example, I'm registered with an NHS practice and I can't get seen. And if you know people with dentists, all it takes is a phone call here and they say, look, would you mind seeing this athlete, or would you mind seeing this? And it's amazing what can happen when you've got a network of dentists around. And that's what the WhatsApp group and the UK WhatsApp group is brilliant, and the world WhatsApp group is brilliant as well, because between us, we'd be more than happy to help an athlete out, especially if they're young and they're trying to break through, and you want to try and help them kind of get onto the right path. And if there's something that it makes you feel good as well to say that you've kind of helped them too, and then they appreciate that, and that'll kind of stick with them as they grow up as well.
Yeah, definitely. And if there's any dentists out there that have been listening to this and they're looking to do some research, don't be afraid to reach out to Saul and pick his brains to see how he went about it, and get a bit of advice. And even better, come to Manchester and have a chat with him in person. Do as much networking as you can.
Yeah, definitely. And I think, John, are we not down to the final? Well, not the final tickets, but the final full tickets. I think we're just only a handful left, right?
Yeah, there's only 3 or 4 full day tickets left. So if you're thinking about going and to the full day and you haven't got your ticket, get on it. I think the early bird prices are meant to finish the end of this month as well, but we might push that out for another couple of weeks as well. So if you're looking to make a saving, get on to it now as well. So that was a good chat. What are you at this weekend? You'll watch the third Lions test?
Well, we are actually away. We are going to Barcelona on Friday.
Oh, you're away to Barcelona.
Yeah.
Very
So
good.
my wife,
Will you do a tour of the new camp?
No, because I've been to the new camp, but I didn't go inside the new camp. It's my wife's brother actually lives in Barcelona, in Sant Cugat, which is just outside Barcelona.
Okay.
So we're going to go and stay with him, and then his wife's family have a lovely house slash apartment somewhere nearby, which we're going to go and stay in for 4 or 5 days as well. But we're going to just take a little bit of a breather and go and spend some family time away. But I will try and watch the Lions game. I'll have to get some VPN so I'll be able to watch it on my iPad when I'm there. I don't think there's a sports bar in Sant Cugat, so I'll need to get VPN. What about you?
Yeah, what's that? So how's your Spanish?
Uno cerveza, por favor.
Yeah, that's all you need to know.
Yeah, that's as far as I goes. And yeah, no, my daughter, she knows more Spanish than me, to be honest. So I'll be getting her to do the translating.
Barcelona is a lovely city. I've been there once before. Then we actually got a bus from there to the run of the Bulls to Pamplona.
Oh,
So
yeah.
It was quite interesting because
See, I honestly think Barcelona is one of the most beautiful places I've ever been. Like, it's got everything. It's a city and it's beach and it's just lovely. The food is. I know we've talked about food before, and Greek food is hard to beat. But you know, the Spanish food in Barcelona, just everything about it, just fresh fish. Oh,
yeah, it was great. I just remember a lot of mopeds. There was just lots of mopeds when I was there. I'm sure it's the same. It was like one of the most best ways to get around the city was on a moped.
Yeah, it probably is. We're actually going to rent a car as well for the few days that we're there too, and go drive around and see a few bits and pieces. But yeah, I think it's meant to be roasting hot. It's going to be mid-30s, so right up my street, John. I'll be taking factor 15, just making sure I've got plenty of that on.
Yeah, I'm saving my factor 50 for next month.
Very good. Yeah, so that was great from Saul. Like John said, just reach out. Please buy your tickets for Manchester. We're only about 6 weeks out now, I think. So time will run. And yep, if anybody has anything they would like to discuss with us, of any idea of guests coming up, we have got some really, really good guests, kind of diverse guests, I would say, coming up in the next few weeks. So keep your ear out, and yeah, hope you enjoy listening. And remember to leave a review and like and follow and all that jazz.
Just as Umar said. I don't know. You can like and follow podcasts, can you?
Well, I think you can you can. You like, follow, leave a review. John, you should be helping promote this, man. Come on.
I am. I'm telling people to leave us 5-star reviews, but I don't even know if you can. I don't even know if you can. I think that's more of like a Google thing, is it?
No, you can. You can leave reviews. You can leave reviews.
Yeah.
You can leave reviews. You can leave 5 stars, ideally, likes, and just rip it to John as much as you like. So,
Yeah.
Also one thing, the merch is coming along nicely.
Oh, we're getting merch.
Yeah,
That's right.
we're getting.
We'll be showing it off hopefully in Manchester, so another reason to go.
Yeah, absolutely, absolutely. Right, big fella. It's always a pleasure.
Right. Yeah. Until the next time.
Until the next time, mate.
Chat soon.
Perfect.